Welcome to the American Amnion Association podcast, a show dedicated to exploring the groundbreaking advancements in birth tissue-derived medical technologies, the power of collaboration, and the future of regenerative healthcare. Each episode, we bring you thought leaders, industry pioneers, and medical experts who are shaping the next frontier of healing and patient care. Today, I'm especially excited to welcome Dr. Jaideep Banerjee, a recognized leader in regenerative medicine and wound care innovation. Dr. Banerjee is the National Director and Head of Medical Science Liaisons at Smith+Nephew, where he leads national teams and clinical strategy across the company's advanced wound care and biologics portfolios. I had the pleasure of hearing Dr. Banerjee present at the American Association of Tissue Banks conference in October, and I knew right away I wanted him on this podcast. His insight, clarity, and vision for the future of biologics and wound healing are exactly the kind of perspective we want to share here on this platform. Please join me in welcoming Dr. Banerjee, scientist, educator, and thought leader helping to shape the next generation of regenerative medicine. Welcome, Doctor.
Thank you. Thank you very much, Teresa. It's an absolute pleasure to be on your podcast, and welcome everyone.
Oh my goodness, it's a pleasure having you. Yes, as I had said on your introduction, your just grand introduction there, you have so much experience, and as soon as I had the pleasure and privilege of hearing you at AATB last month, I was really keeping my fingers crossed. I really wanted you on, so I'm really excited that you agreed to come on. And yeah, and I just, tell me about your background. It's so just immense and broad. How did you get really focus into the birth tissue side of things?
Yeah, so I got trained as a cell and molecular biologist. I'm a proud Buckeye. During my Ph.D. and then I did two postdocs, one at the U.S. Army Institute of Surgical Research in San Antonio, Texas. That's one of the largest military burn centers in the country. And then at George Washington University. And all throughout my PhD and my postdocs, I have been working in the field of wound healing, starting from, cells to mice to pigs to humans, and exploring the different cellular and molecular signaling pathways, how it triggers, movement of a chronic stalled wound towards a more acute phase, and finally healing, how you can handle biofilms. There's wound healing is such an intricate, such a complicated cascade of events. As I was transitioning into the next stage of my career, I came across a company. I used to live in Maryland, and I came across a company which was pioneering the use of birth tissues, the use of amniotic tissues in the space of wound healing. So the company used to be called Osiris Therapeutics. Um, and I met those leadership team. I learned of what they have done. There were a lot of firsts in what they have pioneered in using the birth tissues and, elucidating the mechanisms of what kind of cells are there, what do the cells actually do, what happens when you don't have the cells. And it instantly struck a chord with my scientific training and my I would say the passion for cutting edge research, and I thought this might be a good place to go into in our next stage of career. And so that's how I entered into the space of birth tissue, because I started working with the company who pioneered. I think birth tissue, as you and I think all of our viewers know, this has been in the use in the surgical space for a long time. Like I recently made a LinkedIn post, and I think many people have seen that. It's really a kudos to the mothers, right? It doesn't end up after giving birth to a child. It just, the placenta and the birth, they just keep on giving, right? And scientists have long ago discovered that even after the baby is born and you are about to discard the tissue which seemingly has done its job, has so much still left in that tissue to be helping in any surgical process, which essentially is a wound. Um, so all of that sounded very fascinating to me, and this was a company which was pioneering. And as I said, this has been used for a long time. The challenge has been how you preserve it and then use it. And so this is where I came into this company to learn how they have been doing this preservation techniques and how they've used in the surgical space. So that's my entry into this world.
That's wonderful. And that was one of the things that really struck me um, during AATB with your presentation was that you really, really did honor the mother and the donor. Um,
Absolutely.
and there aren't, I mean, it's funny. I in from when I come across, doctors and just scientists and researchers, they all appreciate obviously where this kind of, potential miracle tissue comes from, but they don't necessarily really just understand the huge gift that the mothers,
Absolutely.
offer when they do decide to donate. And when you mentioned that, just how just how wonderful it is, and just how you recognize the importance of that, I just really thought, wow, this guy here is just he gets the entire just cycle of the whole thing. And
Thank
so
you.
I just, yeah, no, it was wonderful. And you said too, I'm going to go back as well, I mean, you have all this breadth and years of experience. I'm based in San Antonio, so I'm very familiar with
Oh,
BAMC and very
yeah.
familiar with, yep, yeah, their wound care center. And I'm wondering if you could kind of give me just kind of a time span as far as, when you were here, because it sounds to me that you were here when it was just kind of starting to gain some traction. Is that a correct assessment?
Uh, I do not know how I should have. I probably should have known when ISR was founded, but when I came into ISR, so I was there from 2014 to 17. It was already a very well established research institute and research center, and that was also a very, I would say, life changing experience for me, being working with ISR, or as it's called, Institute of Surgical Research, because what I felt before, so that was my first postdoctoral fellowship, and before that, when you do your PhD and when you're working in the lab, a lot of it is you're working on the bench. Yes, you've isolated some cells, you're working with mice, but it doesn't go deep enough to realize what does this really mean. Like you're really scratching the surface, right? But at ISR, there's the center, and you or whoever has ever visited ISR, there's this center called Center for Intrepid, and it's one of the biggest. I think, if I may be wrong, but one of the biggest rehabilitation centers for soldiers and people who have been at war. And I still remember the day when I went in for a tour there, and looking at these people who have come back from war, defending the country. They've lost maybe their limbs. They're trying to get back to the society. And each one of the people I met there, they were ready to go back to fight for the country at the next moment they can. And to feel that, what we are doing in the lab is at some point in the whole life cycle of a product, or from, you know, starting from a cellular mechanism to this actually being a commercialized product. At the end of the day, it is to help these people, whether you have, fought for the country or whether you're a civilian, doesn't matter. But the point that these people, I work for a company, the motto of that company is Life Unlimited. And I really think I connected that message there, that these are people, even when they have lost a significant part of their body or their life, they are willing to go back and do what they want to do. And to know that I work in a profession that can contribute back to society like that, I thought it really makes sense of, and you can only enjoy what you're working when you really understand the depth and gravity of it. So I think working at ISR, beyond the science and beyond papers published, and I think it was a very life-changing experience for me.
Yeah, well, obviously. I mean, wow. It seemed like it really kind of propelled you, into
Absolutely, yeah.
where you're at now. Yeah. And then, so then you said, so after then 2017, you joined the organization
2018.
2018.
Yeah, sorry, it's therapeutics, yeah. So 2014, 17, and then I was in George Washington University for my second postdoctoral fellowship.
Okay.
But again, still working in a vascular surgery lab, different aspects. So at ISR, it was more about cell proliferation, fibrosis, scarring, infection. At George Washington University, it was looking at angiogenesis. So I stuck to the same field. I think that helps in understanding from A to Z of how a pathology works.
Mhm.
But yeah, so George Washington University was also in the field of wound healing. But that's when that was in DC, and this company was also in Maryland, close by. So it sometimes helps if you're in the same region to find a job,
Right.
at least your
Right.
first job.
Yeah.
But things aligned, and it worked out.
That's
I was at the
wonderful.
right place at the right time.
Hey, you know what? There are no coincidences. I truly believe that
Exactly.
everything
Exactly.
always happens the way it's supposed to happen. So yeah. And then and you were and talking about that, when we first started talking, you were talking about as far as just the properties of it and, the cellular versus acellular, things of that nature. What are
Right.
you finding with that? There are so many well, there are so many different really cool like technologies that are going on right now, and there's still a bit
Yes.
of a debate between, that kind of cellular versus acellular and just, just the processing and that kind of stuff. What are you finding with that? What's, what are you seeing that ticks? I know that I mean, you relayed to me that we need, much more as far as clinical studies to back this up, but just from your experience, what
Sure.
are you seeing?
So I think before answering that question, I think I'd like to think of, again, going back to the properties of this tissue. I think everyone in the audience probably knows what's the structure of an amniotic tissue or an umbilical cord tissue is. It has the collagen scaffold. It has, a lot of the intrinsic growth factors, and then a lot of the different cells that is typically needed for a tissue repair process. But and again, that's why I mentioned the preservation process, because depending on how you preserve the tissue, you might lose some or parts of the components of the tissue, and you will end up with different, I would like to say, different variations of the tissue with components A or components A and B or components A, B, and C. But even if you lose, say, the cells, or say the proteins or all of that, even the fact that you are left with the scaffold, even if it's acellular, I think is a significant platform for tissue repair. It's a scaffold where your body's own cells can come and bind, and then they can, attach, and then they can proliferate, granulate, and, help in a tissue repair. Um, I think what we have seen, and not only us, I mean, many people have seen over the years is, um, yes, that works very good for for a healthier person, but as you start going comorbidities, your body's ability to respond to a compromised physiology sometimes um, uh, gets affected, and so having some kind of growth factors retained in the tissue may be helpful. And then the next category of research has also led to the thought that, okay, can these growth factors actually be responsive to the environment that this tissue is sitting in? Like, if this is an infected environment, or if this is an ischemic environment, you might be getting more antimicrobial peptides, getting more angiogenic factors. So now having the cells preserved in there might, as we all know, the way cellular therapies work is um, respond to the tissue microenvironment, and then scientists have published a lot of papers out there that whatever comes out from the cells is very dependent on what that cell is being exposed to. Nothing comes out just for a reason, without a reason. So that has been the progression in how people have thought about these tissues, that yes, for basics it is a scaffold for tissue repair, but if you can preserve these growth factors, if you can preserve these cells, can it give additional benefits? Now, I think the answer to the question that it is still up for debate. And while there are papers that very clearly show, okay, if I take a tissue and then just give the cells out of it, you see differences in clinical outcome. You see difference in outcomes in the lab. Does clinical outcome show? There are some papers which show. There are some papers which don't. So I think, as you said, more research is needed to really go down the mechanism of action of what happens if you have the cells, if you have growth factors. I think it will also be helpful, and I dare say that as this goes into a BLA kind of mode of as these products come into the market. Right now there are a lot of too many Me Too products, but when there's an incentive of doing research to find out, right now, as you know, most of these, unless this is a 510K or a specific de novo, FDA does not allow manufacturers to claim specific mechanism of actions. And I need to
Sure.
be very careful in what I'm saying there, but this is the fact. And so as manufacturers or researchers, I think there's a very important role of academic researchers to play here, um, to help really us, the community, to understand what happens when you have the cells in there, what happens when you have the growth factors in there. That is when we will really find an answer. I think a lot of in-depth research still needs to happen um, to find an answer to the question that you just now asked. I think while there are trends, while there are research papers which points to one over the other, this is still up for debate.
Yeah. And you brought up a very good point as far as with the FDA. And I often wonder, what are the what are the challenges, as far as kind of going forward and wanting to do these, clinical trials and clinical studies. And if you have, if you've encountered anything like that, or if there is I guess what I'm saying is that within the FDA, much respect, it seems like sometimes it's more of a hindrance and more challenging to bring forward these types of potential clinical studies than not. And not saying anything against the FDA by any means. I'm just wondering if in the future a just because I just believe in this tissue so much. I just believe in this, just I believe in it. If there would be an easier kind of pathway to just get those clinical studies up and running and really find out, the cascade and the mechanism behind. We know it's doing it. We just don't know why it's doing it.
I don't think there's a shortcut to this, because I think what FDA is saying for a reason, so that no manufacturer does false claims. If you have to make a solid claim, you need to have substantial evidence backing it. FDA is never saying that don't do these research, don't make these claims. They're saying do it in the right way, follow the right path, have effective studies to show us that these claims are. And I think that's the answer to it. It just needs more investment and more research. I think, I completely agree. I think a lot of what these tissues can do is still unexplored. there is an open field out there once we start understanding what happens, how do these tissues work, do really these components matter or not. And that's why I mentioned there's a very big role of academic researchers who are not bound by commercial interests or financial reasons, who are fully invested in understanding the science behind this. They need to do these experiments in the lab, and they need to tell the community that no, why this is exactly why this tissue, or maybe what we are thinking is wrong. It doesn't matter whether there are cells or there are growth factors, but that research needs to be done, and done with rigor, with proper scientific design and rigor and everything, and that's when we know. And I think that area is still lacking.
Yeah, yeah. And why do you think that that's lacking?
Uh, from an industry standpoint, again, industry invests in research where you can start making claims. And because this was not something, I'd say, as a binding for someone to bring a product in market, as in case of many other medical devices and stuff like that, you cannot just bring a product in market without substantial claims. A lot of the industry has gotten away with it. So I think as soon as FDA comes down and says that no, if you want to, and I mean they have very well come down now. I think no manufacturer can claim these kind of mechanism of action unless they actually have data showing it. And I'm glad a lot of companies are starting to do BLAs, starting to do 510Ks, and I think this is the way forward, and that is going to incentivize the research. And also, this is still a comparatively newer field. I mean, this has been used in clinical space for a long time, but most of the papers, I mean, clinical papers has nothing to do with mechanism of action or I mean, it does, but it's more about the clinical observations. And I think there are plenty of papers out there which shows clinical observation. Now, is there enough papers to compare a cellular versus an acellular, something that I have actually published, 2024, the current data, if you do a meta-analysis of all the different CAMs or skin substitutes, or as we say, there is not a very clear statistical difference between one versus the other. That can only happen, and it's just the answer is that it's a matter of time as more and more people publish level 1 studies, as more and more, or head-to-head studies. Again, industry typically, does not want to do head-to-head studies because we don't know which way it will go. But again, if independent researchers start doing that, that will really start telling us this category is better than that category. This category is same as that category. So it needs to start coming from the independent researchers, and we will know an answer to that.
Yeah, yeah. Tell you what, if I was an independent researcher, I'd be all over it just because
But
go ahead. I'm sorry.
yeah, but irrespective, again, as I said in the beginning, irrespective of how we process these tissues, this does not take anything away from the amniotic tissues in general, because whether you have cells or not, whether you have growth factors or not, I think these tissues still help a majority of the patients that are getting these tissues, because it's at the minimum, it's still providing a scaffold for the body's healing mechanism to get a support. It's some of those high risk, very comorbid patients. Do they get an extra benefit from having these other components? I think that is where the researchers come into play to find an answer.
Yeah. Yeah.
And
And
I also want to I want to clarify something also, very just to be very transparent. These are my personal views, so I think just for everyone to understand, these are my personal views, not tied to the company
oh,
at
for
all.
sure. Oh,
Yeah.
yeah, no, for sure, for sure. And I really appreciate you sharing those with me. And and then on the Smith and Nephew side, I mean, you've brought so much to that. And you've been with them for how long now?
Almost 7.5 years now.
Wow. Wow.
Yeah.
So when you joined, were they were they as invested in this type of just medical innovation?
Oh, yeah. So Smith and Nephew, as a history of the company, this is almost a 180-year-old company, right? And
Great.
if anyone goes into the history of Smith and Nephew, this again, that's very fascinating how it started off with ISR. The history of this company started off by making the first surgical kits for war soldiers, like the first. It's called the elastoplast. It's like a waterproof surgical dressing for soldiers for in World War One. There was nothing like that, and it's just amazing if you think of it that way. And as much as I know, we had T.J. Smith, and we had his who was a chemical engineer, and there was his nephew who was a textile engineer. They got together, and please forgive me, anyone who. If I'm saying anything wrong, if I know from my memory that is how it is, they got together and they first met that. So there has been a history of innovation all throughout. And again, Smith and Nephew has other branches, orthopedics, and sports. But just if you look at the wound care, over 200 years, we have constantly innovated and brought in different technologies that ultimately helps the patient. And so, as part of that vision, is when Osiris Therapeutics became part of Smith and Nephew, because they realized that there is a story here. The Amnion or these tissue products have a significant role in helping these patients. Going to this whole concept of life unlimited, right? Again, this is not just a branding message for me. Uh, we see these patients every day who are such a I recently published if I can talk about that for a second, a venous leg ulcer study with these tissues, and so many of these patients have restricted mobility. They cannot go out in social parties. The pain, odor, smell. And if you can use some of these technologies, and I'm not no way saying that this is the only technology, but this is one of the technologies that can help these patients, right? And as we all know, wound care is a mixed bag. It's not one miracle product. But if you can use all of these things in your tool bag to help this particular patient to suddenly start going to grocery shopping and go to a party and invite friends at Thanksgiving or family at Thanksgiving. That's a huge thing. And I think that is what is life unlimited, where you're not restricted, you're not limited in your life because you had a tissue injury or because you have a wound. And the fact that a tissue which was going to be discarded in the dustbin can prevent or can cause your limb salvage or prevent an amputation and extend your lifespan and helps you get back to life. Uh, that's innovation, and that's why Smith and Nephew, I believe, got this was that's how I came into Smith and Nephew, though. But this is why Smith and Nephew thought this is part of the innovation, and we became part of the rich legacy and history of Smith and Nephew. So yes, and we are constantly innovating. It's no way this is the stop. I mean, we acquired a company which has a technology. We have improved on that. We are still trying to see if we can even improve them more. So the journey continues, and every day is hopefully a better day than the previous day, and we have a more improved solution than what we had 10 years ago.
That it's amazing. That's just amazing, and I mean, from a personal standpoint, and I just mean, my father is a double amputee. He lost his legs, a leg in Vietnam, and ultimately ended up losing both above the knee in 81. And I often think of, if this type of technology was available, that perhaps maybe his limb could have been saved. Maybe and it just it's I just love hearing stories like that, as far as just the progress. And I really, again, my own personal belief, I think that this type, birth tissue derived medicine, I really believe that it should kind of be, a lot of times, depending on the doctor, obviously, and condition, but it should be kind of the first line of defense, and not necessarily, kind of the end. if I may say so. And that's my personal opinion, doctor. So I just,
I will respectfully disagree with that a little bit here. And the reason is if you understand the way tissue repair works, these tissues can only help if your body's general physiology is working. So
okay.
I think in our wound healing field of what we term typically as good wound care, I think it's very. There was actually a paper that was published a few years back where the researchers show that if you don't do that basic wound care that you should do when a person goes to a clinic, in our terms we call it, debridement, or making sure the blood flow is there, because this is a very energy dependent process. This can be severely limited if there's inflammation, infection. Once you have done that, then you should be ready for using a technology or a tissue like this. If you go and slap a tissue right at the beginning, there are every chance that this is a waste of time and money because the wound is not even ready for it. So our body actually needs to be ready for a tissue like that. And I think the nurses and the doctors need to make sure first that yes, we are actually ready. The wound bed or wherever we are putting this, this is actually ready to be helped. Now, this I'm talking of a superficial wound. Internally, these tissues, as long as you're using it in the right way, based on your regulatory framework, of course, but they are used head to toe. I mean, they can be used as a wrap or a cover. So different indications, different anatomies may be different, but I think the bottom line is these are not miracle. Well, we like to call them miracle tissues, but the body needs to be ready for that. And I think this is, I mean, I wanted to quickly mention two things. One, I think something that I've really enjoyed as part of Smith+Nephew is this is, as I mentioned, this is one of the toolkit. There are other things that is in the bag which can help a physician to make the body ready for getting this tissue onto the patient. But I also want to take a step back. And if I look from outside, in these last, say, 20 years, we talk about misuse of these products and we talk about, there are so many amnions in the market. But what this has also done is this field has also explored, like, a lot of these companies are publishing research on use of these tissues. The reason we are talking this podcast and the reason everyone is thinking or wanting to believe is because so many research papers have started to come out. Um, uh, so I think it's not just us; it's the combination of all of these manufacturers, all of these companies who are investing their time and money to understand how these tissues work, understand the clinical data, whether it's prospective, whether it's randomized trials, or whether it's registry data where people have had these tissues for a while and we get to know what kind of outcomes have come out. So it's the entire amniotic research world who has contributed to this. I mean, I'm Smith+Nephew, I'm sure is honored to be a part of this, and I am even a minuscule part of that. But I think it's the entire research world which has and is still contributing to this field. I think based on all the changes that is coming from FDA and CMS, this will just keep getting better because now the incentive is thrown back into quality evidence, into scientific evidence. So it's a positive outlook in the research field of amnions, and we'll just keep learning more and more.
No, that I completely agree with that, and very, very well said and eloquently said. And I appreciate the education in regard to, just that whole that the body has to be ready to
Yes.
accept, the tissues. So that's very, very helpful to me. And I'm sure that most people out there are like, "Oh, you idiot, you should have known that." But there are a lot of people that, are viewing this podcast that really just want to understand just the process and this is very helpful.
Just to clarify, I think I, I agree with what you said. This should be the first line of defense, but I think what I was just to clarify, what I'm trying to say is this should be the first line of defense, at least in your mind, that this needs to go on. But what I try to say is, yes, this should not come like I've tried everything else or everything has failed. Let me try this. I think as we get more and more evidence, doctors will have more confidence in, yes, I know I want to put this on, but let me do the due diligence and let me make sure that it is ready before I can put this on. I think that is what I was trying to say. Yes, the evidence is getting there and should ultimately support why this should be your best option, but you should have the ground well prepared before you build a house. Do you need a house? Yes, you need a house, but you cannot just suddenly think, oh, I need a house and start building it. Let me do the groundwork, let me do the foundation, and then we go and build the house.
Makes complete sense. Yeah, no, and I really appreciate that explanation, and I appreciate the analogy too, So yeah, and what do you see, what excites you the most for the future of this? I mean, does anything just like, wow, like I can see this happening and this is going to be amazing. I mean, what excites you? What motivates you to keep doing what you're doing? That's a tough one.
Uh, in the field of amnion or in general?
I would
No,
say
I mean,
both.
for
Yeah.
yeah, for both, I think the fact that we know so little. I mean, we know so little on how the body works, and every day we are, even for, I mean, I'll just give an example. I mean, we have a product in our portfolio which has been out in the market for 50, 60 years now. Even as of last year, we discovered a completely new mechanism of action of how. So it's like your jigsaw puzzle, right? When you get a jigsaw puzzle box, this is what I need to build, or this is what is going to happen. And then you have all these scattered clues, you have all these scattered pieces. But how do you piece them together to finally make that story? And I think as a researcher, as a scientist, I think that's what keeps on driving. We know this product works. We know that we have seen the clinical outcome. It is very clear this works. But knowing the competition, and that's absolutely the right way to do. If there's a provider who has 100 different options, they want to use the one which has a solid evidence, and both clinical as well as scientific. As scientists, as researchers, how do we piece those evidences, or how do we piece those clues together and discover those clues at the same time to connect what we think this is a great product, what we have seen as a great clinical outcome, and then support it with the scientific evidence to have actually confidence in that clinical outcome, to know that this is not an artifact, this is not, we are not cherry picking the data, this is actually what is. So just discovering so much of the unknown, I think, is what keeps on driving. And it might be for the same technology as I just now mentioned, or as we are, I mean, the entire area of regenerative medicine is changing every day. I mean, whether it is new drugs that are being discovered, the whole world of exosomes, and you know uh, who knows what will be there in another 5 years. It might be a completely different thing, and at the end of the day, we are just keeping on improving patients' lives. So I think that's my fodder, that just understanding, and the role that I play in the company and what I do is also communication. It's not only doing the research, it's effectively communicating it to the customers and the patients. Someone who is in the clinic and putting a tissue like this, they also need to know what this tissue do. And because, and, again, if I can say, a lot of tissue repair, a lot of healing also has a lot to do with compliance and
Totally.
psychology. So the fact, if the patients are really educated, oh, you're putting in this technology, this is actually how it works, and it needs to be at different levels as who needs to understand how. But I think that's also very, very helpful in, if they believe in what the physician is putting on their body, I think they start becoming more compliant. I think they start becoming more, I mean, just take an example of these amnion grafts, right? I mean, we keep hearing this all the time. You put this on a patient on a diabetic foot ulcer, and the patient is starting to walk on it because the patient is a smoker. You don't realize how you are yourself impairing your tissue repair process. And once they start understanding, this is why this tissue works, this is why this technology works, I feel they start becoming more compliant too. I mean, nutrition, taking care of a wound, keeping it clean, avoiding things like smoking. These are just some examples, obviously, but this education, I think, is going to help in this field as we move forward. And as I said, one of my roles is not only being involved in the research, but effectively communicating the research to to the end user, who is both the physician as well as the patient.
I
Um,
love
and that drives me. That drives me if I can communicate that science.
I love that. I love how patient focused you are. I love that. I think that I agree with you completely. I think that, more patients obviously need to understand, as far as treatment and compliance and things of that nature. But, I do think that we don't do enough. Obviously, you do, and I love that. But we don't do enough, I think, as far as communication on this specific, with birth tissue
Right,
derived,
right.
medicine with the patients. And I think that, yeah, the more armed and educated they are, I think that the more perhaps, faster maybe this, will take off. Maybe, researchers will say, oh, well, now there's patients and, regular laymen, like me that are super interested in it, and, let's pursue it. So I love that outlook. I think that's just such an outstanding outlook.
Thank you. And going back to your question, why hasn't been there more research? I think I mean, there is obviously a lot of research going on, but my point is this is all connected. As there is more research, they start getting applied to more patients. As the patients see these beneficial outcomes, they advocate for it. They tell the physicians, "Hey, I think that I've seen this work. I want this." And the physicians go back to the companies and say, "Hey, we need more of these products." So all of this grows together as we develop more and more research from a scientist standpoint. The physicians start using them more. The patients see the benefit more. They start talking more about it, and it completes the cycle where that drives the research. So I think the products will speak for themselves, and they will drive all of this if this is really something that does for tissue repair, as we would love to believe, it is going to be an organic development over the years, to drive research and evidence and adaptability of
That's
these dishes.
wonderful. And one last question, what do you see the challenges? What do you see? I mean, if there are any, I mean, even potential dangers. I mean, like what we were talking about earlier, where it's kind of, just the Wild West, and I'm really happy about the FDA and, CMS just kind of going, whoa, wait a minute, this is no. Um, do you see anything like that, or do you see with what FDA and CMS are doing just kind of to protect the patient and the doctors, that the research will continue to flourish and clinical studies will continue to, pop up and just prove all these awesome things or not?
I do. I think I'm an optimistic person. I would like to believe. I do think research will continue. There definitely needs to be help from the government and the infrastructure to incentivize research, not just go for the cheapest product or uh, uh, but again, I don't believe that will happen, because if scientists really show the government that no, this has benefits, this can have a definitive effect on patients' life, there is no reason why government will not, because after all, we're all working for the patient. So I don't think research will stop. Based on policies, it may be fast or slow, but science has always progressed. It has never gone backwards. So I would like to think that yes, this will keep on going forward.
Love it. Great way to end. You were
Thank
a
you. No,
fantastic guest, Doctor. Oh my goodness, I'm so thrilled that you decided to come on and just it was just
no,
such a pleasure speaking with you.
same here. And you said at the end that we need to reach more patients, and a podcast, your podcast, and I've heard others also on your website. These are the ways to educate the patient and as well as physicians, and more they hear things like. And I was actually very. This was my first meeting at AATB, and I think again, I mean, it was a room of what 200, 250 people, if not
Yeah.
more. But more importantly, it was I typically talk to one part of this entire cycle, right? Which is either the physicians or maybe scientists. But this was a room full of people from procurement to manufacturing to reimbursement to regulatory to the end users like the physicians. And it was really nice to see the entire family together. If you can call this Amnion family, the entire family together who are trying to um, do something for the patient. So I think it was an honor to be invited to AATB, and thank you for bringing me on as a guest.
Kidding.
It's really
Pleasure
shared my
mine.
thoughts.
Yep. And I'm stealing Amnion family. I love that.
Okay. All right. There we go.
Well,
Thank you
thank you,
again. Take care.
Doctor, so much for being on. It was such a pleasure, and I know that our viewers are going to really appreciate it.
Thank you. Thank you. Thank you
Wait.
again.